These are the contraindications to shockwave lithotripsy. This is a method used to break up kidney stones to help you pass them. I'll also list some mechanisms for these contraindications. The three absolute contraindications are pregnancy, bleeding disorders, and anticoagulation. In pregnancy, there's a risk for damaging the fetus directly. You don't want to harm a developing fetus. In the bleeding disorders and anticoagulation therapy, you have a risk of uncontrolled bleeding and hematoma formation. Impaired blood clotting and anticoagulation can make your chance of this happening higher, and your complications harder to deal with. Some relative contraindications: patients that have large aortic or renal aneurysms, these can rupture or expand from the shockwave treatment. Patients with untreated UTIs, you're essentially risking spreading the infection, for instance, disseminating it into the blood would be a bad thing. Patients with ureteral obstruction distal to the calculus can have stone fragment impaction and increased obstruction, so you might actually make their obstruction of urine worse. Patients that have an implanted pacemaker or defibrillator might have electrical interference from the shockwave lithotripsy with their implanted cardiac device. You should have careful ECG synchronization to prevent device malfunction, and you might also turn off the device if you're able to. Patients that are morbidly obese have less effective treatment with shockwave lithotripsy to begin with. They have an increased distance between the beam and the stone, which reduces the efficiency of fragmentation.